talk about high-risk newborn. Some of the stuff I've already talked about. Preterm, right? So this says 38 weeks. So it all depends if you're going to look at 37 weeks or 38 weeks. And then you have low birth weight, very low birth weight, and extremely low birth weight. So your extremely low birth weight are going to be your 24, 25, 26 weekers, 26, 27, 28, 28, 29. So it just goes from a preterm baby either prior to 38 or 37 weeks, depending what, we're going to go with 37 because that's what most of the books say. So then babies can be low birth weight, very both low birth weight or extremely low birth weight, but then we also are going to look at what's in red. And this is stuff we've talked about already, appropriate for gestational age, small for gestational age. IUGR is those babies show more like they have, it's a little more severe than SGA. And so you can have symmetric, in which the weight, length, and head are all affected, or asymmetric, in which the head is normal, but the birth weight still is below. So it just kind of depends what's going on. And then you have large for gestational age. So late preterm is this 34 and 36 to 6/7. Thank you, because I feel like 37 is term. And again, I talked about this in the previous one. Late preterm can still have the same problems. And what are the big things we were looking at? We look at temperature, we look at hypoglycemia, feeding difficulties, and again, you can always get into sepsis and things like that, especially if there's GBBS and they weren't tested for it by that time and things like that. Preterm infants are going to look skinny. They look skinny. They don't have a lot of subcutaneous fat. Their ears are not, their ears like don't have cartilage in them. They're like super soft. They are very overstimulated, and so you'll see in the NICU, the lights are low. They have blankets over, all things like that, because preterm babies are also going to have underdeveloped neurological systems, and they are going to get very easily stressed out. And so NICUs try really hard to keep babies, keep it quiet and keep an environment that's not going to stress them out. So the biggest issue we worry about in preterm babies is lung surfactant, right? Which is why we do the antibiotics in moms who we're afraid may the steroids in moms who might deliver early, because we're trying to increase lung surfactant. Because if they don't have enough surfactant, their alveoli cannot open and close, they can have respiratory distress syndrome, and so all different things kind of move like that. This is why you'll see a lot of preterm babies on their stomach, even though we're taught back to sleep, and it has to do with helping with oxygenation, is kind of the takeaway from that. They have such a hard time managing their temperature. They just absolutely do. They have very thin skin. They don't have as much brown fat, and we see brown fat over the liver, over the shoulder blades. That is where you store your brown fat, and it actually causes that non-shivering thermogenesis. So basically, it causes your body to burn the brown fat to cause thermoregulation. And so bigger babies have brown fat that their body can burn and keep their temperature regulation up. So they don't have a lot of fat. They have a large surface area. Their head is one of their largest surface areas. And they're just everything is immature, from their digestive system to their temperature system, everything. And you'll see their bellies look kind of big compared to everything else because they just don't have fat anywhere. So if their temperature is less than 36.3 or greater than 36.9, we're worried, right? So that's their axillary. And then they go ahead and they'll actually put you'll see with babies often will have a sensor on their belly. But also if they're cold, they can't eat. And then we also find babies, they have a weak cry, they have a weak suck. And so even if we have a mom attempting to breastfeed a new preterm baby, we will have the mom limit breastfeeding attempts to 15 minutes because it can burn so many, babies can burn so many calories trying to feed that they're negative. It's still net negative, and they're still not getting what they need. So we limit and supplement. And preterm babies are supplemented. And it's one of those things that they are often supplemented with breast milk once the mom is able to pump. Sometimes they'll use donor breast milk I know at the NICU they have a lot of donor breast milk, and that then is fortified and it's screened and things like that. Some may have to use formula, but these babies, it's a little bit different than a postpartum mom because we can't rely on the baby to regulate. Remember, it's supply and demand when you're breastfeeding. So the more the baby sucks, the more milk a mom makes. It's supply and demand. So what do we have to make sure our preterm moms are doing? They have to be pumping, because the baby is not sucking enough to cause the body to make the amount of milk that they need. So we have to make sure these moms are set up with a breast pump. So how do we know a baby is having issues? Hypoglycemia, respiratory distress, all of these kinds of things can cause that. So what do we do to try to keep babies from getting cold? We try to warm up the delivery room. We dry the baby immediately after, and then we remove the wet clothing. We try to do skin to skin. You'll see babies 29 weeks and less, they'll actually use saran wrap or a plastic bag that they put the baby in, especially with those very low birth weight babies that we talked about earlier. All of those kinds of things. And then they always have to watch for overheating, because I like to say babies have a hard time heating up, and babies have a hard time keeping themselves warm as well as cold. So they have a hard time cooling themselves off and a hard time heating themselves up. So all different kinds of things. You're going to be looking at fluid and electrolytes. If they're breathing fast, they're going to be losing a lot of fluid that way. Their kidneys may not be working as well. Their kidney regulation is immature, just like everything else. Everything else is immature. So we want their urine output to be at least 2 millimeters per kilo an hour, right? So if you have a 3,000 kilo baby, that'd be a pretty big preterm. Let's think. That'd be huge. I'm sorry. I'm thinking grams. If you had let's say you had a 2 grams, so 2,000 milliliters. So you would have to do 1 kilogram, so 2 grams, so maybe 4 cc's an hour, right? If you had a 2,000 gram baby. So that would be 2 kilograms, so 4 cc's an hour. So it's a tiny little bit. So they're weighing diapers and things like that. The fontanelle, if it's sunken in, that's not a good sign. All of those kinds of things are things we're worried about. And then we worry about overhydration. Again, so that's what's going to cause the bulging fontanelles. You worry about getting fluids in the lungs, things like that. So every system is immature. Their skin is very fragile, very thin. There's not a lot of fat. You have to be very, very careful with tape and all sorts of things, because even oxygen around the ears can cause skin breakdown. So you'll see there's all different cool kinds of things that are made in the NICU to help protect baby's skin. And we know that a lot can have issues with pain. So there's a newborn assessment of pain scale that is used often, and they'll use things like pacifiers, breastfeeding, kangaroo care, is that skin to skin, things like that to help with pain. And babies that are in pain will show a lot of these things, and we see this a lot of in our newborn abstinence syndrome. So these are babies who are the NAS scale is used to see how bad babies from moms who are addicted to opiates. And so these babies can really have a hard time with that transition. So all different kinds of things. They try to group care. So you try to do care at once, not spreading it out. You try to do everything at once. So care is clumped and grouped together so that you can promote rest and peace and things like that. We're concerned if a baby is, nasals are flaring, things like that. If they're grunting, if they're circummolar cyanosis, all of those things are things that we're concerned about for oxygenation. And with these preterm infants, you're really looking for overstimulation too. Signs, yawning, all those things can be signs that they've had too much. So basically, we've kind of talked about this and nutrition and things that they're going to do. They really aren't going, most babies are going to be lavage fed at first because they aren't going to be ready to nipple feed, because it can just, if their respiratory rate is too high, they don't have the whole breathe, suck, swallow thing down, so it can take a little bit of time. And that's why babies might stay in the hospital for a while. So it's usually adjusted age. If you have a 34-weeker, you're probably going to be in the hospital in the NICU 4 to 5 weeks to that adjusted ages term. That is typically kind of and that's sort of if nothing else goes wrong. Some babies can become apneic during nipple feedings. They can show signs of cyanosis and paleness, and that's all, these babies are going to be on pulse oxes to see, can they tolerate feeding? And so more signs are not tolerating feeding, is, again, we can't have prolonged feeding times because they will burn all their calories they're taking in. And so a lot of what babies are doing in the hospital is learning how to feed and staying until they're ready. We are very concerned about what's called NEC, and that's necrotizing enterocolitis. And many babies who die in the NICU die of NEC, and it's basically a infection in the gut. And so one of the ways to do that is to use breast milk. And so that's why they will use donor breast milk for moms. And it's donor breast milk that has been, screened and all those kinds of things. So here's a picture of kangaroo care, right? That's a great picture. And I love kangaroo care because nurses were the ones who did all the research behind that. Here's a dad feeding baby. So here's a grandmother holding the baby. They really do try to get the family involved as much as possible. It's one of those things that can, you really want to try to promote bonding in something that can be really hard. So really a baby can't go home until they can maintain their weight, maintain their temperature, breathe, suck, swallow, all of those kinds of things. So there's a lot that can go into that. Things we're most concerned about is respiratory distress syndrome, chronic lung disease, and intraventricular hemorrhage in the brain, necrotizing neck, which I talked about, the enterocolitis. And then we always worry about retinopathy too. A lot of the oxygen that babies need can have effect on the retina, and I'm not really sure why, it just can. And so a lot of babies will have follow-up eye appointments if they've been in the NICU. So then you have a baby who's post-term, so we're looking past 42 weeks. A lot of these babies have meconium staining because they've already pooped. Their skin is cracked and peeling. They can be chunky. And why is their skin cracked and peeling? Because all that vernix that protects the skin has sloughed off because they've been swimming in the water too long. And they can have a hard time maintaining, yeah, there you go, look at all that cracked skin. This is when we used to put dye on the umbilical cord, which we no longer do. That's a very old picture. So post-term infants can have issues with feeding and things too. Small for gestational age can be all different things depending on the weeks, remember? So you could be 37 weeks in small for gestational age, 38 weeks in small for gestational age. And these babies can have a hard time maintaining their blood sugar, right? Just like large for gestational age babies can have a hard time maintaining their blood sugar. So again, a lot of the things that we're looking for here's our answers. Changes in respiratory status, A, B, and D are all signs of overstimulation. So whether you're large for gestational age, whether you're small for gestational age, all of these can have an effect on baby. So that's it. I'm done.